The rapid increase in new Covid-19 cases in Greece is putting medical professionals under intense pressure. In recent days, admissions have hit record numbers. Well, Euronews' Faye Dukeri joins us now from Athens. Thank you very much for speaking to us, Faye. Look, the first wave in Greece was nowhere near as severe as what we're seeing now in the country. What are the theories as to why that's happening?
Good morning, Rosie. Yes, this is a really important question, but no one can really answer that. The scientists say that the virus is more easily transmitted in this second wave. That's why we have a spike of infections and the rise of infections, but they cannot really say why this happens. The big difference here in Greece is that in the previous wave, we had the nationwide lockdown. Now the government is going to do anything to avoid that, according to what the Prime Minister Kyriakos Mitsotakis said. In order to avoid a nationwide lockdown, the Prime Minister today is going to announce new measures. According to our information, he's going to announce an even stricter curfew from 10 o'clock in the evening from 12:30, which is the current curfew. And he's going to announce masks inside and outside everywhere in Greece. Now masks inside and outside are mandatory only in the high-risk zones. At the same time, health officials say that the health system is already in a critical condition.
Doctors in Greece are warning about the decrease in the beds in intensive care units due to the rapid increase in coronavirus cases. Admissions in recent days are hitting record numbers, resulting in an increase in patients admitted to the intensive care units as well. More than 1,000 people are being treated all over Greece for COVID-19. 70% of the total intensive care beds in Attica have been covered by COVID-19 infected patients, while in the rest of Greece the ratio is 45% of the beds.
The increase in the numbers is so great that if the epidemiological studies are accurate, we'll have 4,000 cases a day until Christmas. As you can understand, the system won't be able to cope. It's impossible for a system with 4,000 cases a day to cope, no matter how much we strengthen it. Even if the doctors can manage, we won't be able to cope.
Due to the increased number of patients treated with coronavirus, it has become difficult to provide other health services, while at the same time hospital administrations are forced to close clinics and convert them to COVID clinics.
We're also entering a season when we'll have other infections. In November, December and January, we will have H1N1 flu. So together with this whole situation, it's difficult for the operation in the hospitals. We all need to see what we can do and what each one can offer to avoid the scenes we saw abroad, in Europe and in America. One case after another being intubated and the doctors deciding who will come in and who will not.
Scientists warn that respect for the measures is the key to reduce the spread of the virus.
Even though the health officials say that the health system is already in a critical condition, they don't suggest to the government a nationwide lockdown. They say that the key to overcome the situation is to respect the measures that have been imposed.
Faye, thank you very much, live there in Athens.